Hello, and welcome to this webinar on adult scoliosis. Today, I'm going to share with you how you can eliminate your adult scoliosis pain and deformation without invasive surgery. In this short video, I'm going to show you the discovery of a lifetime, an all-natural way to completely eliminate the pain and distortion that comes from adult scoliosis. I'm going to show you how to finally crack the scoliosis pain code, so that you can experience the blessed relief that you've been dreaming of. You don't need to go through invasive surgery. Watch, and I'll show you a new plan that I've developed that can take away your misery once and for all. I want you to know that you do have a choice. You can resign yourself to constant pain, which sucks the very life from you, or you can take a few minutes to listen to every word of this important message, follow its advice, and experience blessed relief. Long-lasting relief without medication or surgery is within your grasp. Let me ask you a few questions. Does your scoliosis leave you feeling hopeless? Do you feel like your curves' slow but relentless progression is out of control? Do you worry about becoming a burden, not being able to work or look after your family? When was the last time you had a day without that relentless, never-ending back pain? Imagine not carrying a pharmacy around to make it through the day. Instead of faking a smile because of feeling lousy, you could experience a real smile. See if any of these scenarios sound familiar to you. Maybe you've been suffering from constant stiffness and back pain because of your adult scoliosis, and you're probably wondering, what's wrong with my body? You may be about ready to give up on ever feeling normal again. Or maybe you're already receiving treatments for your adult scoliosis, but you're not getting better. You're following your doctor's orders and still having constant pain. You're beginning to question your caregiver, wondering, is there a better way? You may even feel your adult scoliosis pain is getting worse with each treatment. You follow your doctor's orders, and instead of feeling better, your pain gets more intense and more debilitating, keeping you from getting your work done and giving you a short fuse. Some days, it seems your doctor has run out of answers and has given up on making you better. Or maybe you're already getting bounced around from specialist to specialist, having more tests done, paying more co-pays, and beginning to think, is this what I have to look forward to for the rest of my life? Or worse, you hear the dreadful words from your doctor. Sorry, there's nothing more I can do for you. You'll just have to learn to live with the pain or have surgery. If you're like most adult scoliosis sufferers, pretty soon you're taking 4 aspirin a day, then it's 6 per day, 8 per day, maybe even over 10 tablets of painkillers each day. You start grading your pain as a 1, 2, or 3 tablet back pain. The sad truth is this. Almost everything you've been told about adult scoliosis is wrong. In this short video, I will share with you how to dodge the myths, lies, and confusion and eliminate your fears and doubts about your adult scoliosis. You will be shocked by your discovery of what I call the adult scoliosis X factor, the real cause of over 80% of adult scoliosis pain. After studying and treating adult scoliosis for over 30 years, I was shocked by my own discovery of the adult scoliosis X factor. The X factor rocked my world. I have great news for you. Adult scoliosis is treatable. There is hope. Many adult scoliosis sufferers have experienced relief from the pain, disability, fear, and poor self-image that often accompany scoliosis. Now you can be one of them. I'm going to show you how to beat adult scoliosis pain by taking advantage of its weakness. Scoliosis pain has an Achilles heel. I'm going to reveal what that hidden weakness is and how it can be used without dangerous drugs or painful surgery. You are about to discover the solution for scoliosis that you never believed was possible. You can change the course of your scoliosis progression. You can do something to change your future. The power is in your hands. There will be side effects to this treatment, truly amazing ones. This approach goes beyond the usual conventional approach to treating adult scoliosis pain. Listen to what one of my patients, John, from British Columbia in Canada, has to say.
Before I came to you for treatment, I was in almost constant pain. My posture was all wrong due to compensating, and the compensating created more pain. I took lots of painkillers. I couldn't stand for very long, and I didn't know what exercises would be harmful, therefore I hardly exercised. Now I regularly do the exercises you gave me. My posture is good as I constantly think about the right way to stand. I rarely suffer from pain and feel like a new man. Life is good now. Thanks, Doc.
Here's another testimonial which really describes the hope that you could experience.
I had been having back pain for 40 years, and I had been to many physical therapists, chiropractors, doctors. Nobody had any coherent way that they proposed that they could help me. So the pain got worse over the 40 years, and it got to the point where I hardly knew whether I was standing up straight or not. I was sitting at the kitchen table one Sunday evening in June, and my back hurt so much, and the pain on the right side was creeping up to my shoulder blade. And I thought, I have to do something about this. So I went on the web, and I found you. And I thought, well, let's give it a try. This person says he treats only scoliosis, basically. So he has to know more about it than other chiropractors with a general practice. And I am absolutely delighted. My experience has been so positive. The staff, all of the ladies, are so helpful. You are so helpful. And even better than all of that, the icing in the cake is that my headaches have almost disappeared and my back pain has retreated down to my lower back again. I've been doing my exercises faithfully, and this has been no problem for me because I've always exercised. I had an x-ray last week, and compared to the first x-ray I had, the progress has been unbelievable. The curvature in the spine above my waist is 10 degrees less than the original x-ray. I thought that was fabulous. It's a pleasure to come here. I look forward to it. I think it's important to know it's possible to improve your condition. I think I got very discouraged, and I think many people get very discouraged when they have years of pain. And to think that there is something out there that, with the help both of yourself doing the prescribed exercises and the chiropractor doing his bit, because it's a joint project. But the most important thing to know is that there is hope for improvement. And not only is there hope for improvement, there is improvement. So the thing is, you don't just have to accept it, but you do have to find the right person. And I feel very fortunate in having found the right person in Dr. Strauss.
This can be you just a few short weeks from now. It is actually possible today. First, I want to get into the 4 most dangerous myths about scoliosis. Here are several dangerous and harmful myths about adult scoliosis that can cause patients like you to suffer unnecessarily. But brace yourself, you are about to discover the 4 medical myths that have been proven obsolete, yet doctors still haven't changed their treatments. Myth number 1. Mild scoliosis curves rarely progress after skeletal maturity. Many scoliosis patients have heard again and again that their condition is not likely to deteriorate as they get older, especially if their curve is mild. This just isn't true. No matter what kind of scoliosis you have, your curve is most likely to continue to progress later in life. Myth number 2. Curves always progress linearly and predictably. If it's been a while since you were first diagnosed with scoliosis, you may be under the impression that your curve will progress at the same rate that it always has. This is not always true. While the type of scoliosis you have is a factor, many patients experience more drastic and unpredictable progression of their curves later in life. Myth number 3. If you have no pain from scoliosis now, you never will. Pain is very likely to develop later in life, even if you had no pain as an adolescent or young adult. In fact, as many as 92% of adult scoliosis sufferers develop pain from their scoliosis. Myth number 4. There is nothing I can do except to have major spinal surgery. Medical specialists themselves perpetuate one of the saddest and most destructive myths of all. There is nothing you can do to change the progression of your curve. You can only watch and wait. Tragically, much of this pain and deterioration is preventable. I'm excited to share with you the only real solution that I've discovered to correct scoliosis. Hi, my name is Dr. Andrew Strauss, and for the past 35 years I've had a bold obsession to find the most innovative and effective long-term solutions to scoliosis back pain. This passion has brought me all over the world to learn the guarded secrets of the most revered specialists that defy the standard medical expectations and restore a pain-free body. Because of this mission, I've been reducing pain and improving the condition of scoliosis sufferers from over 30 countries. "10 years ago, I discovered a way to provide chiropractic, physical therapeutic, and orthosis solutions that relieve pain and improve the quality of life for scoliosis sufferers. I call it the adult scoliosis X factor, the real cause of over 80% of adult scoliosis pain. Before discovering the adult scoliosis X factor, I thought the treatment of scoliosis was very difficult. This is because in studying scoliosis treatment, I found many different ways to treat scoliosis and many conflicting theories. But once I cracked the code, I was able to dial into the exact combination. I was able to open up a new level of relief. Now, fast forward 10 years, my patients come to me from all over the world to give them the relief that they've been seeking for many years. I've become the doctor that patients come to when all other options fail. I'm the last resort for most of them, and yet I get most of my patients relief where there was no hope. I'm incredibly passionate about helping scoliosis sufferers like you experience relief, hope, and freedom. I've developed a very comprehensive program for adults with scoliosis, and I feel very good offering them a solid method to help them when they have found so many dead ends before finding me. Here's a brief testimonial that discusses the improvement that can be found from this type of treatment, not only with pain, but also with lung function.
My experience has been really, really good, and I follow up with the exercises, and so now I have literally no pain. When I go up the subway stairs, I find that I can actually get up without like I was going before. And I was kind of like surprised when I came up after the treatment, and I didn't feel that way, And it never bothered me until after menopause. And then all of a sudden it got really bad and the pain started with it. I want to stay with my exercises and improve and, keep myself young and healthy. Thank you. Thank you, Doc. Appreciate that.
You can win the scoliosis pain war with my proven system. It is very gratifying to help adults with scoliosis when no one else has been able to, and seeing them getting out of pain, returning to their lives with reduced anxiety about their future. Let me share with you a story. For example, one of my patients, Wendy, was diagnosed as a teen and had never followed through with any program of care during her childhood. She began to experience strong pain in her 20s. She tried many different therapies and approaches, all of which failed to control her pain. while diminishing her quality of life. She would cry herself to sleep in pain. Her husband suffered seeing her like this, being unable to help her. She arrived at my office in her 50s. As a result of my new program, she had excellent results, and her pain of over 20 years was eliminated in only 2 weeks of care. What really impressed me about her was that she never gave up. Even with so many failures of different care programs, she persisted until she arrived at my office and found success. The determination and persistence of Wendy and her husband really impressed me. Many of these adult scoliosis patients ultimately find themselves at the office of an orthopedic surgeon as a last resort after trying ineffective care like conventional chiropractic, PT, yoga, Pilates. The surgeon tells them that there is no treatment available other than surgery. There is rarely any mention of an exercise-based program of care like what I offer. Unless the patients have the ability to think for themselves, well, I suspect many of them will simply comply with the orthopedic recommendation to have the operation and then regret it for the rest of their lives. Listen to Wendy herself.
Somewhere in my 20s, I had a bout of such excruciating pain that I was rushed into the hospital. I could not stand up. I could not move my own body. I had to be carried. At that point, they took measurements, and he said to me, "This pain is from your scoliosis." The next 30 years, it was 30 years of pain management doctors, specialists, surgeons. I went to New York City. I went to different types of chiropractors. I had pain management from physical therapists. I had physiatrists. And then I stumbled upon Dr. Strauss. And I showed my husband, and he said, you should try this. Even when I went to the surgeon, he said, you don't want to have scoliosis surgery because the outcome is not, it maybe will stop everything, but it may not turn out so well as you would hope at your age. And I did. And I have to say, within 1 week, you helped me more than 10, 15 other doctors, physiatrists, chiropractors. Everyone I saw could help me in 20, 30 years. I'm low 20s to 47-degree angle from my teens to my 50s. And I remember thinking, what will I be when I'm 70? What will I be if I'm 80? What kind of future do I have? And now I feel like I have power to manage my pain. I really feel like I have more control.
I just want to let everyone know that relief is possible. You don't have to go through life suffering anymore. You don't have to go through painful surgery. You can feel great once again. I'm offering a custom-designed, effective program of care that makes it possible to treat yourself at home. I'm offering a real alternative to surgery. I'll explain everything in just a moment. First, I want to touch on the 4 biggest concerns for adult scoliosis sufferers. Number 1, pain. Though it is rare for scoliosis to cause pain in adolescents, pain is a common symptom of adult scoliosis. Number 2, disability. Another terrible consequence of untreated scoliosis is disability. You lose your freedom to do the things that you love to do and can become less and less independent. Some severe scoliosis sufferers cannot even stand or walk because their condition is so degenerative. Left untreated, scoliosis can cause you to be confined to bed, unable to move without the aid of someone else, and completely without freedom to do the things that you enjoy. 3, progression. Even worse than the severe pain or limiting disability that can occur for scoliosis sufferers is the feeling of utter helplessness to do anything about it. When you do not receive treatment for scoliosis and simply watch and wait, you are vulnerable to the likely outcome that your curve will get much worse over time. Scoliosis sufferers can, and often do, progress drastically in a shorter period of time as you get older. Number 3, progression. Even worse than the severe pain or limiting disability that can occur for scoliosis sufferers is the feeling of utter helplessness to do anything about it. When you do not receive treatment for scoliosis and simply watch and wait, you are vulnerable to the likely outcome that your curve will get much worse over time. Scoliosis curves can and often do progress drastically and in a shorter period of time as you get older. Number 4, aesthetics. While pain, disability, and the progression of your curves are the most serious and urgent results of adult scoliosis, the way that you look when you go about your daily life is a very real and important consideration for scoliosis sufferers. It makes you extremely self-conscious. Even if you are experiencing no pain, your scoliosis appears as a disability in the eyes of people you see at work, at the supermarket, at gathering with friends, everywhere you go. The good news is that treatment for your scoliosis can stabilize and possibly even modestly reduce your scoliosis and allow you to experience less pain, disability, progression, and being self-conscious. Research shows that significant postural improvement is still very possible. Are you at high risk of experiencing one of these major symptoms of adult scoliosis? Let's listen to a 27-year-old man discussing his experience with adult scoliosis.
I had a lot of discomfort in my back. I had to stop and stretch out my back or crack it in weird ways several times a day. I think I was diagnosed in 10th grade, and they didn't do anything really because it wasn't intense enough, because the standard procedure is to wait if it's not that bad, right? Because they're still growing.
Yeah.
So I had x-rays done. I went to another chiropractor just for general chiropractic help. I tried acupuncture too. That was amusing. But it didn't really. All it did was really mitigate the problem, the observant problems, the general pain and discomfort. It didn't actually visibly change it. Yes, very happy. I like seeing improvement. Yeah. I hadn't seen any improvement since I started looking into this, and it's just been getting worse and worse, but it's good to see improvement. Basically, the main medical procedures is weight or surgery. So this is, I think, a much better step to try to look into.
While there's no way of knowing how your condition will progress or deteriorate as you get older, there are some factors that increase your chances of unpredictable progression and the pain, disability, and poor self-image that accompany it. To determine your level of risk, it's important to understand the different types of adult scoliosis. Which are you? Number 1. Adolescent scoliosis in adults, or ASA. This is the adult version of scoliosis that developed during adolescence. Once skeletal maturity is reached, a patient with adolescent idiopathic scoliosis is now said to have adult scoliosis. There is typically a slow increase in the curvature that began during teenage years in an otherwise healthy individual that can become progressive during adult life. Where does that put you 10 years from now? 30 years from now? Number 2, degenerative, de novo scoliosis. This is scoliosis that starts later in life, around age 45 or older. This type of scoliosis often deteriorates more rapidly and less predictably than adult idiopathic scoliosis. It often comes about as a result of some other issues, such as arthritis or the deterioration of discs and joints. Research shows that even if the curve can only be modestly reduced, you can still achieve drastic changes to postural alignment. Traditional treatments require that you either do nothing or commit to dangerous and risky surgery. A key point to understand about your pain. Stress causes muscle tension. Tense muscles reduce blood flow, causing buildup of waste products within the muscles themselves. This buildup is a cause of unbearable back pain. When we take aim at the root cause of the problem, we can eliminate the muscle tension. When the tension is relieved, proper blood flow resumes and the pain goes away. It's that simple. The following options are what you've been told are your only way to experience relief from your scoliosis. As you can see, none of them are satisfactory because they do not address the root cause of scoliosis. Additionally, they are risky, uncertain, and in some cases, downright dangerous. Option number 1, watch and wait. You already know how risky, dangerous, and uncertain it is to take this traditional advice. While it is possible for our exercise-based scoliosis programs to prevent further progression and pain, it's more challenging to treat progression and pain once it's already begun. Besides this, Watch and wait has serious implications for your mental health. Traditional medicine does not always account for the fear, uncertainty, and hopelessness that are a part of the daily lives of those with scoliosis. Option number 2, risky and dangerous surgery. Nearly every scoliosis sufferer has considered the option of surgery as a solution. Many patients who feel helpless to improve their condition think that this is the only way that they can have control over their situation. It's easy to see why. Faced with daily pain and disability, the patient would rather pursue the small chance of hope that surgery will help them than take a chance that their condition will get even worse over time. Option number 3, ineffective and uncomfortable bracing. For over 500 years, the scoliosis back brace has been used, but there has been no definitive evidence of its effectiveness. The goal of scoliosis bracing was always stabilization, not correction, and all too often a scoliosis brace even failed at stabilization. Scoliosis braces were ill-fitting and sought to lock the scoliosis into the distortion. Well, that does not work and is seen by many as just a waiting room for surgery. If only there was a properly designed brace that could be a powerful aid to our corrective program of exercise-based care. Well, great news. There is. A new type of brace has recently been released for adult patients who are at risk of postural collapse. The new brace design is called ScoliBrace. This was released in 2012 and utilizes a unique supercorrective scoliosis bracing method. This innovative new design reduces pain, improves postural appearance, and can even prevent postural collapse from happening. We now combine use of the ScoliBrace with my custom-designed program of home exercises. Many of our adult patients will wear the brace 3 to 6 hours per day and get excellent symptomatic relief when used in combination with my exercise program. Yes, there is a time when bracing is necessary, but this is rare when using my new method. Now you no longer have to live with the hopelessness, fear, uncertainty, pain, or disability that accompanies your scoliosis prognosis. And you don't have to live with the poor options with which you've been presented in the past, either watch and wait, have surgery, or wear an uncomfortable, ineffective, and conspicuous old technology back brace. There is something you can do about the progression of your adult scoliosis. There is a solution besides waiting and watching your curves get worse or undergoing risky and ineffective spine surgery. I offer an alternative solution for scoliosis sufferers using proven chiropractic, physical therapeutic, and orthotic treatments to retrain the muscles and central nerve system to address the root cause of scoliosis rather than treating the symptoms. My program teaches the brain to help you stand and walk correctly by using neuromuscular re-education, or NMR. By repeatedly teaching the brain to move in different ways, it carves neural pathways for improved habits of movement. Once these muscles are retrained with specific exercises, it opens the door to improvement in motion that reduces pain and further progression. In many cases, it actually reverses progression. This is how my solution leads to permanent and effective improvement for scoliosis sufferers. The top 5 benefits of my new exercise program. Number 1, reduced chance of future pain, disability, or deteriorated aesthetics. This is the primary concern for scoliosis sufferers. Number 2, more energy. Many of our patients have reported more energy to do the things they love to do, such as spend time with their family and friends, be independent, and have enjoyable and productive work lives. Number 3, more lung capacity and more room for organs. Many scoliosis sufferers do not realize the effect their condition has on their lung capacity and organ position. Once they begin to see improvement from their treatment, they can't believe the advance in comfort and health that they feel. Number 4, gives patients control over their condition. Scoliosis sufferers can finally be done with that feeling of hopelessness and helplessness for good, because they know that they hold the power for real and lasting change. Number 5, reverses curve progression and significant postural change with improved cosmetic appearance, yes, it is very likely to see substantial postural improvement. My program has given scoliosis sufferers freedom, quality of life, and peace of mind. What would you give knowing that your condition will not get worse but will improve instead? What would you give knowing that your life can be pain-free? What would you give to have your quality of life back? Now, the choice is yours. You no longer have to live with the pain, disability, fear, and uncertainty that you've experienced every day since the onset of your scoliosis. Here is an 81-year-old patient who presented with degenerative adult scoliosis.
Dr. Strauss started my therapy. My back pain was gone in 6 weeks and I can walk well now. Yes, I am now very happy.
Yeah.
Well, her posture is important, got better too.
You no longer have to live at the mercy of uninformed surgeons that only want to put you under the knife. You no longer have to be afraid to go out and live your life the way you want. There is something you can do. There is hope for your condition. You can live the life you've always dreamed of having. I want you to imagine your life without the agony of scoliosis back pain. I want you to imagine seeing yourself free of the scoliosis pain, feeling more vibrant, attacking your day with more pep in your step, having more energy to do those things that matter most in your life. The more you see yourself doing that, see how that affects and spills over to all the other areas of your life. Just imagine how this newfound energy affects your relationships, how it affects the quality of your relationships with those that you love the most. Just imagine how satisfied you feel doing those things that you've been putting off because of the pain. And now that the pain is gone, feel the liberation. Picture yourself waking up and realizing that your pain is gone. And this feeling of relief takes over, and you wake up with a newfound lease on life. Imagine waking up and feeling relaxed, and having this feeling that a new lease on life has just begun. Imagine what you now focus on. It's no longer about just getting through the pain. It's no longer about feeling wiped out by 2 p.m. It's about finally living your life. It's about finally focusing on things that matter to you. How does it feel to be present with your family, your spouse? How does it feel to focus on what makes you happy? Imagine your day with no pain, and a day full of energy, because now it's not being sucked up by your pain. You're no longer dragging through the day. You're no longer feeling like there's this emotional ball and chain in your life. You feel light. You feel relieved. You can breathe again. You can breathe life into your day again. You can focus on the things that matter most. Feel the difference when you're with your family and friends, and they soon realize that you're no longer grimacing with pain, that you're no longer exhausted. See how happy they are for you, and how relieved they feel that they finally have you back. Picture yourself waking up in the morning, stretching, and enjoying the simple pleasures of muscles working the way they should. Instead of focusing on your horrible achy back, you're focused on the day ahead, on its eagerly anticipated challenges. Imagine your afternoon, spending it organizing your life without the gnawing fear in the back of your mind about having to take more medication or the thought of needing painful surgery. I want you to experience the power of what restoring your muscles' natural ability to relax can do for your life, your energy, and your future. The work I do is not about getting you out of pain. It's about getting you your life back. This is what drives me. The quality of your life is directly tied to the quality of your well-being. Listen to what Mandy has to say from South Africa.
The improvement I experienced the first time I was here prompted me to come back again. I'm very satisfied with all the staff. They are all, including Dr. Strauss, very professional and caring, and they go out of their way to make the experience as comfortable as possible. After the treatment, when you get back home, I am so pleased that I'm able to send photos to Dr. Strauss and to receive feedback. I consider this a huge benefit. I had always been led to believe that my scoliosis would continue to progress as I aged, and eventually I would have no other choice than surgery. Dr. Strauss has changed all this for me. My scoliosis has improved more than I thought was possible. I am able to manage my scoliosis much better with the home program. I'm not in pain, and psychologically I no longer find the scoliosis as terrifying as I did before. Finding Hudson Valley scoliosis has been an enormous blessing.
Your life of pain and struggle can soon be over. All you have to do is take that first step and fill out the Contact Us scheduler at the bottom of this page. Set up a consultation with our office, and in 1 or 2 days, you can have a thorough consult with me where everything will be explained about our remarkable new breakthrough program that can transform your life. I want to help you step into a new pain-free world where you live out your life happy, fulfilled, and excited about what awaits you. If you're ready to get your life back and say goodbye to how this has affected every area of your life, how it's robbed you of the quality of health that you know you deserve, then take that small step forward. A journey of 1,000 miles simply begins with a small step. Our unique system of scoliosis care can be the missing piece that you've been looking for that can give you a whole new lease on life, and all you have to do is take that first step that can change the quality of your life. Your life of pain and struggle can soon be over. All you have to do is take the first step and fill out the Contact Us scheduler at the bottom of this page. Set up a consultation with the office, and in 1 or 2 days, you can have a thorough consult with me where everything will be explained about our remarkable new breakthrough program that can transform your life. I want to help you step into a new pain-free world where you live out your life happy, fulfilled, and excited about what awaits you. Right now, my staff is standing by to rush you my brand new book on adult scoliosis called The Truth About Adult Scoliosis, which explains what adult scoliosis is, what the causes of adult scoliosis are, and what to do about it. Your new life is waiting for you. Contact us today.